Alright, I find this SNAPS assignment directions to be a little bit confusing, so I'm gonna talk through it, and if I said something wrong, somebody correct me. But basically there are two parts for the SNAPS assignment. One is gonna be the writing assignment that you're gonna submit um, here, up there. Submit assignment right there. And the other part is going to be the oral presentation. It has a template. This is a template. You don't need to submit the template. You write it out and then you do an oral presentation on Kaltura and you post that on week 5 discussion board. So you would have to do this first and then do this written assignment after you've done that one. Okay, all right, this is the template for the oral presentation. So you're going to pick a patient that you saw in clinical with an acute illness. So you can do a chief complaint, OCART, his issues or her issues, and then you're going to do 3 differentials and analyze the pertinent positive and negative. And then you're going to write 3 questions that you probe the preceptor with or what you would have asked. And then you're going to write out the plan. And then this is the last part is the self-directed learning, which you're going to do for your other part of the SNAPS assignment, which is the written assignment. So once you've done that, you can, all right. This is the SNAPS written assignment template. So for this one, you're going to have to write a summary with evidence-based practice and references. And this one goes to the submission thing. The oral presentation goes to the discussion board. So let's look at what you need to do to get 100% on this. All right. Summarize the H&P in a brief and concise manner. The summary, you need to have chief complaint, HPI, subjective and objective findings that are relevant to the case, and it should not contain additional unnecessary data. So to get full 10 points, you need to have all that. And you need to have all 4 critical elements: chief complaint, HPI. What are all 4 elements? Subjective, objective, summary. I'm not sure what the all the 4 critical elements are exactly, but just read that over. And then you gotta narrow the differentials. Identify 3 to 4 diagnoses. So you would get full point if you have minimum of 3, but no more than 4 reasonable diagnoses. And then you need to analyze with positive and negatives. So like for each diagnosis, you have to be able to argue for or against it. So even if it's the diagnosis that you think that's what it is, you still need to say it may not be this because, right? If I'm understanding that correctly. And then you need to rank it from the most likely to the least likely. And then probe the preceptor. So you're gonna talk about 3 questions that you were confused about. And then you're gonna be able to plan it, do the planning for this patient, like how you're going to confirm the diagnosis, For example, this person may need to go get an ultrasound, for example, to confirm the diagnosis, and after it's confirmed, these are the medications, or like if it's a clinical finding and there is no need to confirm the diagnosis, you would say that, and then you are going to go to talk about cost, availability of the medication or the treatment. So I would probably check like the $4 med list if that is the case for that patient, okay? And then identify self-directed learning topic. All right, so this part, 10 points. All right. So for your written part, you have to have the topic, and you're gonna need at least 3 evidence-based references. Right, you need 3 references. All right, this one says oral presentation. Okay, so the oral presentation needs to be 5 to 7 minutes, and the written assignment needs to be 5 to 7 paragraphs. Paragraphs, not page. 5 to 7 paragraphs. And the research is submitted on the SNAPS template, so you have to use that template. And in-text citation and reference are written in the correct APA format. All right. Oh, okay. So that's it. All right. Let me know if I didn't understand that correctly, and add something in the comment. All right.